Exposure therapy is a technique for addressing anxieties, depression, and a range of mood disorders. As a cognitive behavioral therapy, it emphasizes both alleviating symptoms and restructuring mental models. The therapy is accomplished by introducing someone to stimuli which provoke the fear or anxiety at small, manageable, but gradually more challenging levels. Specific protocols have been developed, and one called prolonged exposure therapy is considered by many to be the most effective treatment for PTSD and all of its related challenges, based on 20 years or more of evidence. Exposure therapies in general are often applied to death and loss, almost invariably from the perspective of the survivors. Witnessing and deeply experiencing the death of anyone, especially a loved one, can definitely be traumatic, but facing your own death is no walk in the park either. Depending on the individual, facing the stark prospect of personal mortality can be traumatizing, depressing, anxiety-producing, you name it. Traditional methods of preparation for dying all involve exposure. Plus, it's a relatively recent phenomenon to have dying people so segregated from the rest of life, to become so invisible, reducing natural exposure opportunities. Meditations on death, for example, are designed to gradually condition the mind to accept its eventual dissolution. To have the necessary effect, the words and images get quite graphic and explicit. Any form of exposure therapy has to be impolite. If it doesn't cross the line some, it doesn't work. Exposure therapy for your own process of dying can take other forms as well. You don't have to be a meditator. Just reading about the physiology of dying, immersing yourself in the details and imagining them certainly provides the exposure, but remember the therapy part. Exposure is powerful. It has to be done in the right tone. Rather than a medical textbook, a better approach might be a work such as Dr. Sherwin Nuland's How We Die. Exposure to the plain facts described with tremendous sensitivity. Dying people themselves can be our best teachers. If only we could sign up for one of their classes. Volunteering with a hospice is one way to do it. The immediate experience of hospice volunteering is totally and uniquely about the dying person, not you. But the effect of the experience can be the same as the results of exposure therapies.